News 4 at 4 starts now. Coming up, Doreen Gensler's working for you, showing you the game-changing technology that can not only find and treat cancer, but also identify other diseases like Parkinson's and Alzheimer's.
Gives a lot of hope to patients like me and patients who will be diagnosed in the future.
Next on News 4.
Nuclear medicine is giving people hope in their fight against cancer and other debilitating diseases. The cutting-edge therapy uses radioactive drugs to treat aggressive late-stage tumors. And in some cases, it helps people when surgery or chemotherapy isn't an option. Doreen Gensler explains how it works in today's Future of Medicine. Hi, Doreen.
Hi there, Pat. Doctors say the treatment is kind of like sending a nuclear warhead directly into a cancer cell. It can be used with chemotherapy or after surgery, but it can also be a good option for people who no longer are responding to traditional treatments.
This was the start of the roller coaster of being a rare disease patient.
Josh Mailman was diagnosed with the rare form of pancreatic cancer more than a decade ago. At the time, the odds were stacked against him.
I was not looking at a lot of time, and you're right, I had a 10-month-old, and this weighed heavy. Would I see his first birthday?
Scans revealed a tumor the size of a softball in his pancreas, with the cancer spreading to his liver.
You've got to go to war right away. Well, it's challenging when you have something that can't be surgically removed.
Because of the location, surgery wasn't an option, and he wasn't a good candidate for chemotherapy either. That's when Mailman heard about nuclear medicine and decided to go overseas, traveling to Germany for treatment.
Those 3 nuclear medicine treatments almost cut my disease in half and got rid of all the symptoms that I was experiencing.
That treatment for neuroendocrine tumors uses liquid radioactive drugs to specifically target a protein on the cancer cells, obliterating them without hurting the surrounding healthy tissue. It was experimental at the time, but in 2018, it was approved by the FDA for use here in the U.S.
This area is growing rapidly. The radioactivity goes right to the tumor and delivers the radiation to the tumor, and not so much to normal tissue.
Dr. Richard Wall is one of the leading experts in the field and says nuclear medicine has been a game changer, not just in treating cancer, but also in diagnostics to help precisely find cancer cells and identify other diseases.
The amount of radioactivity that a patient gets is probably about like what one would get doing a transcontinental airline flight. So it's a very low dose, very safe. And this helps us diagnose diseases like cancer, Parkinson's disease, Alzheimer's, pulmonary embolus.
For Josh, nuclear medicine has been a lifesaver. He's now 60 and has been living with cancer for 15 years, sharing his story to help others like him.
Gives a lot of hope to patients like me and patients who will be diagnosed in the future. And really what we do this for is those who are coming behind us.
20 million nuclear medicine procedures are done in the U.S. every year, but one of the biggest drawbacks is health insurance coverage and reimbursement from Medicare.